I've noticed that you have champions for some of your initiatives on both sides, people from the Republican Party, from the Democratic Party. Is part of your work getting them to find common ground?
The place that I start from is everyone has mental health. And when you have mental health challenges, that's not a Republican issue, a Democratic issue, or an independent issue. That's a human issue.
Well, hello and welcome to the Dr. Suzette Glasner Podcast. Today, I'm very happy to be joined by Bill Smith. Bill Smith is the founder and CEO of Inseparable. Inseparable is a national nonprofit working to make mental health care accessible to all. Since he founded Inseparable in 2020, Bill has led a team advancing numerous significant bipartisan wins in mental health policy on both state and federal levels. His impactful initiatives include bringing organizations together to form the Hopeful Futures campaign, whose mission is to bring mental health services to every child in every school across America. So, Bill, I just want to thank you so much for your time today and for joining me for this discussion.
Absolutely. I'm thrilled to be here.
So I thought we would just start by letting the viewers get to know you a little bit on more of a personal level, just a little bit about your background and where you were born and raised, and maybe talking a little bit about your family life and values as you were growing up.
I grew up in rural Alabama in a small town called Eufaula. It's in the southeast corner of the state. And my parents were small town newspaper publishers. So I sort of grew up in this very civic minded household. I'm the youngest of three boys, which my mother said 3 grown men is always a modern miracle. But the values that I grew up with were really around being engaged in your community, understanding what's going on in the world, and figuring out how you can make a difference and be a part of it.
Oh, that's amazing. So tell me a little bit about how that took shape for you as far as those values and trying to figure out how to make a difference, and where your early days took you out of high school and what you were thinking about your future at the time.
Growing up in a newspaper household, you sort of talk about what's going on in a community and politics and civic life and all of that. So I went to a Methodist liberal arts school, a values-based institution that was heavily focused on service. And after college, I guess I'm a little bit of the black sheep. I immediately went into politics and started working on campaigns and elections, which to me is a natural extension of that civic engagement. And I spent my 20s traveling all over the country working in campaigns and the election business. And I don't want to date myself too badly, but in the mid 2000s, I met a philanthropist in Denver named Tim Gill, who was the largest funder of LGBT equality efforts. And just as I was building this career in politics, Tim and the marriage movement were realizing that even though a lot of work had been done through philanthropy, you really had to engage in politics if you were going to move forward on an issue like marriage. So a big part of my early career was working to build support for that around the country and using the training that I had from the political world about how to build political power on an issue.
Oh, wow. So what do you think were some of your biggest lessons learned in that process? Because I'm sure that informed the work that you do today, even though there are similarities and differences, as we'll talk about.
I think one of the biggest things is to approach politics with the kind of attitude that there are friends and friends we don't know yet. And that while you do build political power and you do focus on having people win elections and execute on a policy agenda, you really have to go into it with an attitude of addition, not subtraction, because the bigger your coalition, the more you're able to get done. And so much of that informed my work in the public policy arena that I was in. And I brought all of that with me into Inseparable.
Yeah, so maybe tell me a little bit about what the path was for you from your work in politics to founding Inseparable.
Yeah, while I was bouncing around the country doing politics, as I said earlier, I grew up as the youngest of 3 boys. And my older brother, Jack, who was a journalist, was suffering from depression, was diagnosed as bipolar, or having bipolar disorder, rather. And unfortunately, we lost him to mental illness after a really long struggle. And And as you can imagine, it was a devastating thing for our family. But having spent a lot of time in the philanthropic space and understanding what you can do in the political world and through public policy, I started looking at the mental health system. I started thinking about the ways it impacted our family and so many families out there. And having worked in a national capacity before, I sort of did the tour of the mental health field so I could learn who was doing what and what needed to get done and what needed to change so that we could better serve people like my brother. Because the biggest thing you realize is that you're not the only person experiencing this. Mental health is an issue that impacts every family in one way or another. So that's really what led me to realize, wow, there are a lot of brilliant people in mental health, clinicians and policy folks, people with lived experience. There are so many people bringing a lot to the table. But what I noticed was really missing was people focused on building power specifically for mental health. So we launched Inseparable around that idea that we need to actually create power for mental health, because the idea behind the name was the health of our minds can't be separated from the health of our bodies. Yet that's what the public policy process has done in our country for a long time to mental health. And so we launched Inseparable around that idea of let's fix that.
I love the name Inseparable because it just makes so much sense and it evokes a certain curiosity about what's inseparable. And do you have a sense of why our country and healthcare systems have separated those two historically?
I think a lot of it has to do with stigma. It's one of those issues that, or at least having spent a lot of time in the marriage equality movement and understanding the role that stigma played for so long in that arena, it's something that I was certainly aware of. But when you talk to people in the mental health space, they'll tell you that we've had a problem talking about mental health in an open and honest way because so much stigma has been sitting there on top of mental health. I think that's a lot of it. And I think we allowed it to be seen as the other and something that's separate and apart from the rest of your physical health. And that's why we really wanted to have the central idea that we were focused on saying, no, look, everybody's got mental health. Some days and sometimes in life, people are at different places on a spectrum, but we really have to think of it as part of health.
Totally agree. And I work a fair amount in both mental health and substance use space. And people sometimes ask me, how far have we come in terms of moving stigma and addiction, for example? My feeling about it is that we've come a bit further in terms of mental health than addictions, like sort of lagging behind. I mean, there has been some progress, but I'm curious what you think. Like, since you founded Inseparable, have you seen movement in the stigma around mental health or substance use?
I think we have, and I do think you're right that there are some differences there in how those issues are perceived. But for us, we look at it as one umbrella. And when we talk about mental health, we really are talking about substance use issues and all of that is one and part of the same. I do think it's changed. One area in particular, I would say, is around youth mental health. You know, when we launched in 2020, at the beginning of the pandemic, people realized that, gosh, we were telling people to be socially distant. It really added to a lot of mental health challenges that people were already having. But youth is one of the things that I think the problem has gotten so big that we're talking about it more now and been able to break through that stigma in many ways. Not that we don't have a lot left to do, but I think that has changed.
Yeah, I'd agree. And youth in particular, there is like a certain openness. It's not so taboo to talk about your mental health struggles now. And probably social media to some extent has helped that because you're able to be a member of an audience to other people modeling that. And since youth are particularly attached to their social media, that of course has its positives and negatives. Probably one of the positives is broader exposure of people speaking openly about mental health.
That's right. You have to say when you talk about social media and mental health, there's blessings and curses. One thing I always say is, gosh, growing up as a gay kid in Southeast Alabama, it sure would have been great to know that there were other people out there going through the same things as me. But also as somebody who works on youth mental health, we worry a lot about the negative impacts that social media can have on young people and their mental health.
Yeah, it's good to recognize the positive that it's doing, but there's quite a bit of risk there that I think we as a society and as a field in mental health are still wrapping our heads around how to mitigate that. And we don't have the answers yet, but we need them.
For sure.
Let me just go back a little bit to your brother. I'd just like to learn a little bit more about him, just what he was like as a person and what your relationship with him was like.
Absolutely. Jack was one of the most interesting, funny, smart, people that I've ever known. And he was a journalist. He went to graduate school for journalism, worked at a weekly paper, and then ended up back in our hometown working with my parents. And over time, he was really one of my biggest champions. And as I was working around the country, we talked a lot about the work that I was doing. And he was an encourager. And one of the things as a journalist that I so admired about his work is first, he was a consummate storyteller. He could meet with anybody and learn their story and figure out a way to let it really shine through. So he did brilliant work on that end. But the other side of that was in the editorial role, he was really unafraid to speak truth to power. He was focused on doing the right thing for his community. And that came through in his editorial voice. And when I think about the things that sort of ground me in my experience in starting Inseparable, I really hope that on our best days, we're bringing those pieces of Jack into our work, that we're good storytellers about mental health, that we're not afraid to stand up and say what needs to be said about fixing broken systems, and that we're encouraging people, because at the end of the day, that's all about hope. And one of the things I will always remember about Jack is he worked to give people hope.
That's really beautiful. It sounds like there's a lot of Jack in your work every day.
Absolutely. I sure hope so.
So were there ways in which your and your family's experience trying to navigate mental health care for Jack that has informed your mission at Inseparable?
Yeah, very much so. And one of the things that I've just learned that it's such a common experience after talking to people around the country about it. But, there's everything from the clinical side of the care and getting that's often complicated. Insurance and how things are covered was something that we certainly experienced. And you just realize how complicated it is to get real access to quality care for someone. That was something that we experienced. And, when you think about a family that's trying to do all they can to surround somebody with the resources they need, and then systems get in the way, it's super frustrating. And it's not the way it ought to work. And I certainly brought that experience into the way that we think about things at Inseparable. You're absolutely right. It very much informed what we're doing.
Yeah, that makes a lot of sense. I mean, in substance use care, we talk a lot about the golden moment of motivation because motivation fluctuates so much in addiction. I think it also does to some extent in mental health in areas like depression, bipolar. Even the highs in bipolar can feel really good. So there's a degree of ambivalence about putting a stop to that and getting treatment. So for various reasons, needing to strike while the iron's hot as a family when somebody you care about is going through something and is really in need of help, having that sort of hampered by challenges in navigating the system and getting them to the place that they need and getting them the help with the immediacy with which they actually need it in order to not lose that golden moment becomes very important.
Absolutely. Interesting. This is a bit of a sidebar, but I watched the series recently on PBS all about the founding of the United States, and it focused in on the Constitution and the Declaration of Independence. It talked about the pursuit of happiness. And I had this moment where I thought, wow, that's really what this is all about. What you want is everybody to have a chance to have a happy and healthy life. And so that's something that I think every family, it certainly was my experience. You just want people to be able to thrive and have a good life and be happy.
Yeah, it's core to everything. I think that those of us who are trying to make an impact on the world in one way or the other are trying to do. Totally agree. That leads me to one other question I actually have for you about the way that you've channeled grief around the processing of the loss of Jack into this pretty big purpose. Do you have a sense of what it is about you that led you in this direction?
My education and my upbringing included the idea of service. And it's quite a gift to be able to work on something where you feel a deep connection to the purpose. I will say it's different, as you say, when it's connected to or comes from a place of grief as well. And I had a clinician friend of mine give me a bit of an image after my brother died. He said, it really is like flipping a switch. There was your life before this happened, and there's your life after this happened. And it's not going to go away. But what you can do is think about how you manage it or what you do with it. And for me, as somebody who spent a couple of decades in the public policy process, Inseparable Inseparable really represents that intersection of what I've had a career doing in advocacy and learning how we can use the public policy process to improve people's lives, and a really profoundly deep connection to the issue through what my family has been through. And knowing that there are countless families who've been through struggles like that, and some not nearly in the same area as a suicide loss. But I actually connect those pretty directly and think of it as a privilege and a gift to be able to take where I am in my career and what I've learned and this experience that my family's had and use it to help other people.
In some ways, it comes back to it has its origins and natural inclination towards gratitude, because even in the darkness and the sadness of your loss, you seem to be orienting yourself towards what it is that you appreciate about the position that leaves you in and what you can do with it. That's not an easy thing to do, but it's one that has a potential to drive more optimism in you and a little bit more of a feeling of control in a way, like you can do something with this that is positive and that helps other people to be happy and healthy. So it makes a lot of sense to me.
Yeah, the thing that I like to say is that we're in the hope business. And I think in the mental health and substance use treatment world, we can sometimes get really clinical and we can get really complex in our language. But at the end of the day, I think it's about hope. I also connect it personally because I saw my brother give people hope. He worked to help other people that were suffering as well. And because he was such a good storyteller, he was able to illuminate what was going on with himself. And I think there's an ability to use that to help a lot of people. And so that's what we're about.
Stemming from that point around your mission and purpose at Inseparable, I've heard you in another interview refer to a big core driving force of what you're trying to achieve as Inseparable as a social movement. And I wanted to learn a little bit more about what you mean by that. Like, what is the social movement and what are the building blocks of that social movement?
A lot of it is if you take a step back and look at different issues where public policy has really changed over time. The marriage equality, you can look at women's rights, you can look at the environment, you look at all these areas where different progress has been achieved. And public policy doesn't always just happen because it's the right idea. You have to have a movement that says this matters to people. And what I learned from seeing so many people who've been working in mental health well before Inseparable was started is that there are a lot of people out there who've been touched by this issue who care about it. And so what we wanted to bring into Inseparable was a movement ethos. There's sort of two meanings to the name Inseparable. The first one is that the health of our minds and the health of our bodies are inseparable. But the second one is that when we all actually come together as a movement, as a social force, we're inseparable in solving these problems. Because I really believe when you bring people together across the political spectrum, across different life experiences, that's when you have the power to change. And so that's what we're trying to build.
That leads me to another question I had, because political affiliations are like so polarized in our society. Hopefully that's changing a little bit. But I imagine that some of your work at Inseparable involves bringing people from across that spectrum together to see eye to eye on an issue, even if they're coming from different places. I've noticed that you have champions for some of your initiatives on both sides. You have people from the Republican Party, from the Democratic Party. Is part of your work getting them to talk to each other and to find common ground? And if so, do you have an example in mind of how you've done that successfully?
The place that I start from is everyone has mental health, everyone. And when you have mental health challenges, that's not a Republican issue, a Democratic issue, or an independent issue. That's a human issue. And if you start from the place of realizing that and understanding what I've encountered when I talk to people, whether it's a rural part of Alabama or downtown New York, is people are trying to take care of themselves and their loved ones. And if you start with that level of understanding, it's actually pretty easy to bring people together across political difference. Because of the way our political system and our public policy system works, we have to work at the federal level and at the state level. And one of the things we built into our plan from the beginning is that we want to work in red states and blue states in every part of the country. It's really important that we demonstrate to people that this issue is not partisan in any way. It's about taking care of ourselves and other people. And so we've been very insistent in doing that. Examples that sort of come to mind are in my home state of Alabama and Montana, Georgia, bluer states like Illinois. We've really worked in every part of the country on things like youth mental health and access to care. It really is something that impacts everybody. And so we think it's important to set that example of working in all the places with anybody, regardless of their political affiliation, who wants to advance this cause.
That makes a lot of sense. And it's a really great example to set. And also, I'm sure earns credibility across the spectrum, which is really important to affect change for your team. So yeah, I want to shift gears and start talking a little bit more deeply about Inseparable and what you've been working on there. Maybe just start by telling me a little bit about what you feel you've achieved at Inseparable since you started and what you think are the key ingredients of your success in those achievements. I know you've had many.
I think I would start with the areas of focus, because when you say something like mental health, that's a huge area. But what we said was we want to take some really specific things that we know are problems or systems that need to be addressed and identify what they are, measure them, and then go run policy campaigns to change them. And the 4 areas that we quickly honed in on are youth mental health, our crisis response system, health coverage issues, and then the mental health workforce. Across all 4 of those areas, we've been working to advance really specific policies. Happy to say that we have been really focused on state legislatures over the last 4 years or so, and we've had 98 different policy wins across 23 states where we've worked with partners. It's things like putting a mental health coordinator in every school district in Alabama, screening for kids in Colorado, more mental health counselors, and working on the ratios of how many providers you have to people and students in particular, looking at insurance and issues that spare policyholders and people from really sometimes ridiculous red tape and delays in coverage. We try to look at the real pain points that people have connected with mental health and work on very practical policy solutions that can build a lot of support to address those. And to do that, that takes a lot of different things. That takes research and storytelling and lobbying and being an advocate. Sometimes it's communications campaign. It's always working in partnerships with other organizations. And for us, what we are relentlessly focused on, because we know at the end of the day that winning will save lives and improve lives, and losing has consequences. So we're trying to win as much as possible to help people get access to the care and services they need.
98 wins across 23 states in the time that you've been operating sounds like something to be really proud of and something very impactful, and the impact continues.
I am proud of it. I would say 2 things. Number 1 is I'm good at hiring people smarter than me. We've got a really good team that's working all over the country. And the second is we really meet people where they are. And there are policymakers all over the country that want to do the right thing and advance mental health. And so that's why we've been really focused on how to work with them hand in glove to get things done.
Yeah, I was curious about, for a lot of people, it sounds like a no-brainer when you say increase access to mental health services or counseling and improve the ratios in schools. And that whole area of prevention, catching it early, screening, identifying, and treating, it makes perfect sense. So part of what I'm curious about is what are the challenges that you've encountered along the way in that initiative, for example? Is it funding related, allocation of funding? What are some of the areas of pushback that you run into?
You're so right to zero in on prevention, because one of the things you learn when you dive into this work is 50% of mental health challenges show up by age 14 and another 25% by age 23. And what that tells you is that we've got to be focused on young people, and that prevention and early intervention and giving people the tools that they need can change the trajectory of people's lives. And sometimes you can put mental health challenges entirely in the rearview mirror for folks when you do that. And so for us, we looked at what are the systems around that. And one of them is school-based resources, meeting kids where they are in schools. and making sure that we're teaching them life skills to be resilient, that they have, when we screen kids, as you said, they have access to care. And one of the things you run into with anything dealing with schools is it's always a funding challenge. And we ask our schools to do a lot. If you think about it, when I was growing up, you had vision tests and you had hearing tests and scoliosis tests and all these things.
Right.
We ought to be doing that for our mental health because it's, as we said, the same as the rest of health. And so you do run into challenges around asking schools to do a lot, but we think this is a great investment in kids that pays off over time.
Have you had the opportunity to measure out some of the outcomes of that investment, or is it still a little bit early on? Because I know data and being driven by data as you form your areas of focus and advocate for them has been really important to you and to Inseparable.
It's really important. Across each of our areas, one of the first things we wanted to do was start with benchmarks about where states are. So looking at things like the crisis response system, and do they have things like mobile crisis teams in a state? How accessible are, short-term facilities if people need those? And in schools, what are those ratios of how many mental health professionals to the number of students do we have? And then in coverage areas, are there policies in place? That means sometimes when you have insurance coverage, it doesn't always translate into care. So one of the things we've done is across all of those major areas of focus is do 50 state reports to look exactly where those states are and benchmarking them and using those as tools with policymakers to say, look, here's where your state is compared to the states around you, and to be able to bring data into that conversation. I think the storytelling is critically important, but it's also really important to stay grounded in the data and then in what we're recommending things that have a solid evidence base. And as you said, some of the things that we're still a little early days and new requirements around screening and whatnot, that we want to do that data collection over time and look at exactly how people are getting care. Are they getting care? And also, what's the quality of that? Because we want it to be good care over time.
Yeah, that makes sense. And are you finding that parents are generally receptive to their children receiving screening and intervention when appropriate in the school setting?
The thing we've seen, because we do a lot of listening, so we do polling and focus groups and things like that, in addition to working with our partners, learn how families are talking about it. Parents are experiencing the issue. And what we found is that regardless of your politics or any of those divides that you see out there, everybody's worried about youth mental health right now. And what we found when we talk about school mental health is that what's essential is that it be a partnership between parents and families and schools and the people that surround kids. Because the vast majority of parents are just trying to figure out how to help their kids when they have mental health struggles. And every once in a while, you do run into kind of a parents' rights argument that we should be doing this at home and not at school. And we believe you should be doing it everywhere. We think there should be no wrong door for any child that wants to get help with their mental health.
Well, and if you think about it, just like we as adults spend most of our time at work, kids spend most of their time at school. So there are behaviors and tendencies that can get noticed in the classroom setting or on the yard that parents just don't have access to. So it's a real area of opportunity to pick up on things that may otherwise have gone unrecognized. And like you said earlier, if you capture or detect those problems earlier and intervene, you may really alter the clinical course and outcomes of that for a young person.
It's so true. And some of the best people you'll ever meet in the world are our teachers and our school mental health professionals. And when those folks work together with parents and families, and you see the impact that they're having on kids, it's just remarkable. So we're big believers.
I know we were speaking about youth mental health, but shifting over to adults, what would you see as like an employer's role in bridging that gap between people who need mental health and or substance use care and those who receive it? And do you have any recommendations for leaders who are making employee healthcare decisions on how they can help close that gap?
I think it's really important And the first thing that employers can do is to create a healthy work climate. You want an environment that supports balance and mental health and collegiality, and also lets people know that there's support if they're having health challenges. I also think employers play a really critical role in making sure that insurance companies really cover care for their employees. I think one of the things we learned during the pandemic was that when you had a lot of people in the workforce dealing with either their own mental health challenges or their children's mental health challenges, either way, those impact how you're showing up at work. And one of the things we realized is that a lot of the coverage that people have isn't always translating into care. And so we'd really encourage employers to ask their employees if they feel like their insurance is working for them, raise those issues. I think that's a really important role that employers can play in making sure their employees are healthy, happy, and have access to great care when they need it.
Absolutely. And I think there were, in between 2020 and the last couple of years, quite a few surveys around employee needs, preferences, and priorities. And a large proportion said they were looking for employee benefits that included mental health, and often found that those benefits fell short of meeting their needs. So it seems to be it's not only on employers' minds, it's like they're noticing from a cost standpoint and from the overall well-being and productivity and health standpoint of their employees. I think adults in the workforce generally also have a heightened awareness that needs to be part of what they have access to in order to optimize their well-being, and they're specifically looking for it.
Absolutely. It goes back to our whole premise that it's all inseparable.
It's all inseparable.
It's how you show up. How you show up in the world, whether it's work, church, family, it's all interconnected.
Yes, it certainly is. What are some of the most concerning trends you're seeing in mental health and mental health care?
Over the last few decades, the trends around things like suicide rates and depression and anxiety and substance use, they've really been alarming. And especially when you look at some of the things around young people and their mental health. We think the issues right now around, we talked a little bit about social media, but things like AI and how does technology influence people's mental health, and the coverage issues, frankly, are some of the biggest challenges that we see out there, where we did an access report looking at all 50 states, and you realize that whether people have public or private insurance, so many times that coverage that they've paid for or their employer has paid for has not translated into them getting the care that they need. And that's a really alarming trend that we think we've got to fix.
Yeah, thank you for highlighting both of those issues. I do think that there has been quite a bit of research on the social media front showing that when young people use digital means of escaping from their pain and their negative emotions, it's like a behavioral addiction version of kids who turn to drugs and alcohol. In a way, it's like they're turning to their devices and all of those things, whether it's alcohol or it's a drug or it's some other thing that keeps their brain occupied and away from what it is that's bothering them. All of those sort of fuel unhealthy coping. And when you don't have healthy coping, your mental health can easily deteriorate. So I think you're definitely onto something there around those trends. And I did notice in your focus areas that you mentioned before, crisis intervention is one of them. And I'm curious, what do you view as like being broken about our crisis intervention system as it is today? And what do we need to do to fix it?
You know, one of the most startling things to me early in my research was when I learned that, you know, this as a Californian, the LA County Jail is the largest mental health provider in our country. That to me says we're doing it wrong, because what happens in crisis response too many times in our country is that people, instead of getting routed to care, are imprisoned or dealing with the criminal justice system. And, you know, what we believe in the mental health and substance use world focuses on is making sure that everyone has someone to call. And if the person that they're talking to, these trained counselors, can help them, as they often can, that's fantastic. But if they can't, they need someone to show up. And that response needs to be somebody who's trained in dealing with people in mental health crisis. And then if they still need more care, that there's somewhere safe for them to go. So it really is important to build out that three-legged stool of a crisis continuum. And the way I think about it is that nobody's worst day should define the rest of their life when there's someone that is in trouble and needs help. What we need to do is make sure that crisis response works in a way to get them the help they need.
I hear a lot of stories of people who really avoid seeking emergency or crisis care because they're afraid that the response is going to be traumatizing in and of itself, that the response will heavily involve law enforcement, which there's nothing wrong with law enforcement because they're here to protect us, but many of whom are not trained in navigating a mental health crisis. And I know training the workforce is another part of your emphasis at Inseparable. Is that something that you've given some thought to as far as how to better equip sort of crisis teams and even potentially law enforcement to be helpful rather than scary as a means of intervening with mental health crises?
When you talk to law enforcement, they'll be the first ones to tell you that we need more people who are trained to do this so that they can focus on the jobs that they have. And we found that there are a lot of people doing really interesting things around the country of getting trained mobile crisis teams out there with people from the community who are a part of the community, right? Makes a huge difference in that. But we've also seen, I remember the year that we launched Inseparable, that there was this horrible story of like a 9-year-old child in upstate New York in a mental health crisis. And she ended up handcuffed and pepper sprayed in the back of a police car. Like that's where the response has caused really significant trauma. And the way you prevent that is by making sure that we have the right resources available so that if you're that parent calling, trying to get some support and help for your child, you're going to get the right response. We think that's really important and that we can build a crisis response system that does that.
It's super important because you want to build something that people are going to utilize and not be afraid to utilize. Otherwise, it's not going to make an impact and it's not going to work. So as we're wrapping up, I'd like to learn from you where anyone who wants to learn more about Inseparable can find you and how people can get involved.
Absolutely. People can go to inseparable.us online and find us, sign up. One of the things that we love when people do is to share their story with us because we think the stories are so important. And Suzette, at the end of the day, we're focused on this idea that good mental health care should be easy to get and easy to afford. And it's not right now in our country. People can't access the care that they need. And we're going to tackle that problem. And we're going to do it by building a movement of people all across this country. So we'd love for you to come to Inseparable, sign up, and join the effort.
I learned a lot from you today, and I continue to be even further impressed with all that you're taking on and all the success that you've realized. I anticipate continued wins from your team and can't wait to follow and learn more about them. I want to thank you so much for taking this time to speak with me today on my podcast. Thank you for all that you're doing.
I'm glad to be with you, Suzette, and I'm grateful for you and all of your work that you do to bring people into the mental health conversation. So thanks so much for having me.
Oh, thank you, Bill. Thank you for watching. And don't forget to like my videos and subscribe to my YouTube channel. I look forward to seeing you next time.